The two-way process of exchange of information between individuals through a communication system is known as A. Interaction, B. Interpersonal relationship, C. Sharing, D. Communication. And the correct answer is D. Communication. Communication is the two-way process of exchange of information between individuals through a common system. Which is not a element of communication? A. Message, B. Sender, C. Attention, D. Channel. And the correct answer is C. Attention. There are 5 elements used in process of communication, that is sender, receiver, channel, message and feedback. Attention is not a part of communication. All are important elements of communication process except A. Sender and receiver, B. Receiver and message, C. Channel and feedback, D. Time and environment. And the correct answer is D. Time and environment. How many elements are there in communication? A. 5, B. 6, C. 7, D. 8. And the correct answer is A. 5. There are 5 elements in communication process. These are sender, receiver, channel, message and feedback. The factor which is not in essential communication. A. Receiver, B. Response, C. Sender, D. Noise. And the correct answer is D. Noise. Again, there are 5 factors for essential communication, that is sender, receiver, channel, message and feedback. Noise is not a part of essential communication. Response from a receiver to sender is known as A. Message, B. Context, C. Feedback, D. Stimulus. And the correct answer is C. Feedback. A message is a signal that serves as A. Stimuli for a receiver, B. Stimuli for a mass audience, C. Stimuli for a speaker, D. Noise reduction. And the correct answer is A. Stimuli for a receiver. The most important skill to possessed by a nurse administrator working in a community setup is A. Documentation, B. Communication, C. Coordination, D. Organization. And the correct answer is B. Communication. The nurse demonstrates active listening by A. Agreeing with the client, B. Repeating everything the client says, C. Assuming a relaxed posture and leaning towards the client, D. Smiling and nodding continuously throughout the interview. And the correct answer is C. Assuming a relaxed posture and leaning towards the client. By assuming a relaxed posture and leaning towards the client, the nurse can demonstrate active listening. Which of the following actions show physical attending? Adopting a relaxed posture, maintain good eye contact, leaning towards the person, presume an understanding of client. A. Option 1, 3 and 4. B. Option 1, 2 and 4. C. Option 1, 3 and 4. D. Option 1, 2 and 3. And the correct answer is D. Option 1, 2 and 3. So, adopting a relaxed posture, maintain good eye contact, and leaning towards the person show physical attending. The use of touch to convey your feeling to a patient is called A. Extrasensory perception, B. Haptic communication, C. Gestalt therapy, D. Neural networking. And the correct answer is B. Haptic communication. Haptic means tactile. Haptic communication is a type of non-verbal communication by which people communicate via touching. Which type of channel is considered as the best one of effective communication? A. Combined, B. Visual, C. Auditory, D. Tactile. And the correct answer is A. Combined. Combined use of visual, auditory and tactile enhance the effective use of communication.